Paula.
Thank you. Good afternoon.
Good afternoon.
I just want to thank you for allowing me this opportunity to speak to you for a few minutes and bring you greetings from Assistant Secretary for Public and Indian Housing, Orlando Cabrera. I'm pleased renewal of that funding for the Main Street vouchers retains the requirement that they be used for the original designated population. So when those vouchers do turn over, they cannot be put in the total overall pool for the Housing Choice Voucher programs. They stay with the designated population, which are families, persons with disabilities.
Give us copies so we can take it to our housing authority.
At HUD, we also have what we call a voucher management system, the VIMS, and that is the way we track the utilization of our voucher, of the mainstream voucher system, and through the family reports that we get. HUD staff have recently contacted agencies throughout the country that are under poor utilization to identify and help them to correct those problems. We're continuing to work with agencies to ensure that all mainstream vouchers are used for their intended purpose and their usage is accurately reported. We know in some cases that has not happened. We are on it, guys. We are trying to make that happen. In February of 2005, the Office of Public and Indian Housing put out a notice, 2005-5, an important notice that explains the Housing Choice Voucher Program in supporting President Bush's New Freedom Initiative and Executive Order 12317, community-based alternatives for individuals with disabilities.
Yay!
And this notice identifies initiatives that could be implemented to assist families with a person with disabilities in their housing search. The notice also reminded agencies of their obligations in connection with special purpose funding, such as mainstream vouchers. The Housing Choice Voucher Program also plays a critical role in something else that I heard in the testimonies today that was mentioned, and that is the Money Follows the Person Rebalancing Initiative. As you know, it's a nationwide demonstration led by the Centers for Medicaid and Medicare in collaboration with HUD to remove barriers to transition individuals currently residing in healthcare institutions such as nursing facilities back into living in the community. As you know, the MFP program, Money Following Persons initiative, provides a substantial amount of funding to pay for Medicaid-based home and community-based care services for persons transitioning from healthcare institutions. During the past several months, this initiative has been rolling out with the grants being awarded to states, and CMS, the Centers for Medicaid and Medicare, and HUD have been and will continue, hear me, will continue to discuss strategies to better connect the Medicaid programs in the 31 states that were awarded the MFP demonstration funds with public housing agencies in those 31 states. What I would like to convey to all of you today is that HUD is committed towards making the Money Follows the Person initiative a successful initiative. We're taking educational and outreach activities in order to educate and to reach out to those that can help us do this. Now, as you know, HUD does not have legal authority to set federal preferences. That is up to the local housing authorities. But what we can do is provide information and encouragement to housing authorities to help them in the planning of their preferences. They determine what it is, and we can use our influence, but you can use your influence too. But it still remains the choice of the local housing authority.
Discriminating
In October of 2006, Secretary Jackson wrote executive directors of housing authorities around the country to explain the Money Follows Person, rebalancing initiative, and encouraging them to set local preferences and coordination with state Medicaid offices and aging and disability requirement agencies administering Medicaid programs to support the initiative. Also in July of this year, Secretary Jackson wrote a follow-up letter, another letter of support, in which he asked for specific examples of successful implementation strategies that are going on around the country at housing authorities with this. And he asked for those by August 31st of this year. We're currently reviewing those that we have received from housing authorities around the country. And in fact, next week, a conference call is already scheduled with CMS to discuss outreach, education, and access strategies regarding this. Also, as Secretary Jackson travels around the country, he intends to highlight successful efforts that agencies have made to promote community-based housing options for people with disabilities and successes of agencies in implementing the Money Follows Person Balancing Initiative. It's nothing like giving an example where others can do it. Some people would say we can't do it, and that's with anything. And if you can give them a living example and said, they did it, this is how they did it, then a light bulb sometimes comes off in someone's head and it's like, oh, okay, they did it, we can do it. We can do it. We're not asking people to reinvent the wheel. We'll have live examples and saying, this is how you can do it. This is a live example. One other thing I want to mention in terms of the Housing Choice Voucher Program that may be especially valuable to persons with disabilities is the voucher home ownership option of the Housing Choice Voucher Program. Hopefully you know about this, but I'm going to highlight it anyway. Under the program option, assistance is provided to first-time homeowners to use voucher subsidy to meet monthly home ownership expenses. And 2 requirements of the program have been modified to make it easier for persons with disabilities to become homeowners. For disabled families, welfare assistance can be considered. Let me repeat that. Welfare assistance can be considered in determining if a family meets the minimum income requirements of the program. That's the home ownership program. And the other thing is there is no time limit on the assistance. For other participants, the time limit term is 10 to 15 years, but there is no time limit for assistance for disabled families.
Yay!
As stated earlier,
All right.
HUD, and I say this with all sincerity, HUD is committed to helping persons with disabilities obtain accessible, affordable, and integrated housing.
Way to go!
Anything that I've spoken about that you want further information on, hopefully most of you know the website, www.hud.gov. More facts and information about the programs is at that website. I invite you to go to that website to find additional information. As I said, sitting here and hearing it, I hear it at the heart. We know what you're talking about. You're singing to the choir. We are committed. Together, we can do a lot. Thank you.
Good job.